Hello and welcome to News Across Nigeria, where we take you on a journey across the 36 states of the Nigerian Federation, telling you what's happening now. I'm Olumide Macaulay. On today's edition, two more suspected cases related to Lassa fever in Jalingo reported. And the Adamawa state government asked for the federal government's assistance over the Yola market fire. The Lagos state government defends its actions in the demolition of a market in Oshodi. And the River State Police arrests more criminals, mops up more arms. We begin with this confirmation from the Minister of Health, Professor Isaac Adewole, that the death toll from the recent Lassa fever outbreak is now put at 40. According to the minister, the disease has also spread to 10 states in Nigeria since the last 6 weeks, when the first one was reported in November. The death toll represents over 43% of the 86 cases reported so far.
It is important that I notify the nation, through you, that in the last 6 weeks, Nigeria has been experiencing Lassa fever outbreak, which so far has affected 10 states in the country. The states affected include Bauchi, Nasarawa, Niger, Taraba, Kano, Rivers, Edo, Plateau, Gombe, and Oyo states. The total number so far reported is 86 and 40 deaths, with a mortality rate of 45%. Our laboratories have confirmed 22 cases so far, indicative of a new round trip of Lassa fever outbreak. In response to these reported outbreaks, the Federal Ministry of Health, under my leadership, has taken the following measures to curtail further spread and reduce mortality among those affected. 1, immediate release of adequate quantities of ribavirin, the specific antiviral drug for Lassa fever, to all the affected states for prompt and adequate treatment of cases.
Minister of Health, Isaac Adewole. Meanwhile, 5 of those deaths were recorded in Taraba State after an additional 2 people suspected to have the disease have died at the State Specialist Hospital in Jalingo, northeast of the country. The State Commissioner of Health, Mr. Innocent Vakai, said 2 others suspected cases are receiving treatment, and those 2 are actually responding to the treatment.
This is the Federal Medical Center in Jalingo, Taraba State, where all suspected cases of Lassa fever are brought for treatment. Already, the state government has set up a quarantine center for those suspected to have the virus, an acute viral hemorrhagic fever caused by the Lassa virus transmitted to humans from rodents. The death toll has increased to 5 as 2 suspected cases died 2 days ago.
Some patients were brought from to the wards, and they were received, and treatment were commenced, and there is a suspicion that there could be suspected cases of Lassa.
While 2 surviving suspects are still receiving treatment, residents have been advised to report any other suspected cases.
The 2 patients, to the best of my knowledge, they are responding to treatment, to the conventional drugs we use in treatment of Lassa fever. They are responding. and we hope they are going to make it. And the Nigerian Center for Disease Control in Abuja has also assisted us with drugs for the management of these cases.
People who develop symptoms like similar to malaria or typhoid or similar common ailments, if they take the initial remedies, whether anti-malarial or treatment for typhoid, and after 48 hours they have not seen any substantial improvement, they should immediately bring themselves for tests for further assessment by the medical team in the hospital.
The Commissioner for Health also insists that the cases they have are still suspected and they are waiting for the results to receive confirmation.
We have sent the samples since on Sunday, and our doctors are currently in Abuja. So any moment from now, we are likely to receive the outcome from the laboratory, which is likely to say either they are negative for Lassa fever, or they can give us a confirmation and say all the cases we are saying are positive for Lassa fever. So if they turn out to be positive, then we can make a categorical statement to say we have confirmed cases of Lassa fever in Taraba State.
As the state government awaits the results of the blood samples, it has intensified its campaign in educating the residents on the dangers and measures to adopt in preventing contamination.